New at 6, when treating stroke victims, time is crucial. A new study finds that doctors may have more time, though, than previously believed. Dr. Maria Simbra has the story.
With a stroke, there's a limited amount of time doctors can give emergency clot-dissolving treatment.
6 hours after their stroke onset, that was kind of the time window that we were looking for.
The problem is when someone wakes up with stroke symptoms, the clock actually starts at when the person went to bed. In many cases, it's too late to do anything besides customary care, which includes blood thinners and blood pressure medications.
So if patients presented after that 6-hour time window, our hands were somewhat tied.
A new study supports a treatment that can be done up to 16 hours after the onset of stroke symptoms. A stroke is where a portion of the brain goes without blood flow and the tissue dies. Symptoms of a stroke can include numbness on one side, weakness on one side, trouble talking or loss of language, double vision, loss of vision, dizziness or trouble walking. It all depends which part of the brain is affected. Strokes are often caused by clots in a brain vessel. Doctors now think other nearby vessels help to maintain some blood supply before the tissue is completely dead, which gives them time to do something called a thrombectomy, or removal of the clot.
We go up through all of the arteries in the body, up into the blockage in the artery in the brain.
The doctor then uses special instruments to suck the clot out of the brain. The study included 182 people at medical centers across the country with strokes associated with the most disability because of the vessels involved. Half got typical care, the other half had a thrombectomy and medications. 26% of the usual care group died, compared to 14% of the thrombectomy group. Almost half of the patients in the thrombectomy group were able to function independently afterward.
If it's within 16 hours, then we should treat it like it just happened.
I'm Dr. Maria Simbra, KDKA TV News.